I do want to mention that these shows are being sponsored by Community Health Foundation of Western and Central New York. We want to thank that organization for doing this.
It's great work.
It sounds like what you're saying is we're about to see a major revolution in how medical care is delivered to seniors in America. And that some of the markings that we're going to be seeing are that people don't want to go into nursing homes, so there's a tremendous effort to stay in the home and all the supports that might be necessary to accomplish that goal, and something called assisted living. But that the financial funding today is a little bit off because really it's set up for things 20 years ago, not the way things are today. Do you think the quality of life from your experience is better for seniors today than it was 20 years ago?
That's a good
That's
question.
a good question. And I think it all depends where they're at. You know, we at the Erie County Home, that's one of our main initiative, the quality of life, even through activities, because many times people think nursing homes is a place to die, but in reality it's a place to live. People die in nursing homes and everywhere because unfortunately death is a part of life. So even last week, or this week, we had their organization come in and ask our residents what do they want to see in healthcare, because many times we don't ask the residents, what would you like to see?
What do they say?
Well, if different things. As a matter of fact, why don't you share that with them? Because she was saying they said the same thing everyone else said.
They need more help.
They want a Harley-Davidson motorcycle? No.
I think people want a choice. I think people wanted, really, we're talking a lot about staffing issues, and that's another issue that leads to all of this, is that there's an insufficient workforce out there. We talk about home and community-based services and where people want to live, but we don't have the workforce to support that. And even in a long-term care facility, there is shortages of staffing. Our paraprofessionals in the medical field, there aren't people who are flocking into schools to go into healthcare to work with older adults or with the disabled.
I'm so glad you mentioned that, Pam, because that is a significant issue, not just in adequate training and resources for people that go into the field of geriatrics and caregiving. Professional caregivers are so heavily relied upon, not just geriatricians alone in the area. There's a handful of them, and it's a national crisis. It's expensive and time-consuming to give proper care to an older person, and the field doesn't attract people the way that others do, and it's actually our growing need. We're constantly encouraging and bringing young people into, through organizations like Network and Aging, bringing them in to help them understand what it might be to work in the field, because it is a significant issue.
So you're saying that in the 2 decades ahead, as the baby boomers you mentioned get older, and I'd say looking around here at the 5 of us, I'm thinking that we're all baby boomers. I could be wrong, but that there is a tremendous opportunity in the marketplace today for people who want a career, either as a nurse or whatever, or a caregiver, a paraprofessional, you call it paraprofessionals, and even physicians, geriatric physicians. This is an area where we need a lot more people.
Even home care. The availability of aides, especially in the rural areas, it's a big problem. You can have funding opportunities available, but if you can't get the aid out to the family, it's no help.
Has there ever been a challenge that you're aware of that's as large as what you see looming? Because the general message I'm getting today is that we've got a huge goal to reach in caring for aging Americans in the next 20 years. Ever been a similar situation like this in America before? I don't know of one.
No. It's a moving target. That's part of the challenge as we look forward to what it looks like. We think we know what it's going to look like. We study it, we ask people, but exactly what it's going to look like with the advances of medicine and as our ability to keep ourselves alive continues. We are a culture that values life and wants to stay alive and healthy. As we continue to be able to keep ourselves living longer, there are growing and changing challenges with that. So that's part of the issue. It's a little bit of a moving target as to what should it look like. For each person, it looks different. Not everyone has the same goal.
More on what all of us can do to successfully prepare for older age when we come back. We're back talking about how Americans are aging, and a bigger portion of the population will actually be over the age of 65. Let's start with a description or a definition of how seniors define quality of life. What are the elements?
Independence. I think they want to have a sense of independence and the ability to make choices and have a say in their future.
More so than any other generation
Yeah.
in America. The baby boomer generation
Yeah.
desires independence. What's another element?
As she said, choices, and one of the things we do at the Erie County Home, I have to keep saying that, is they actually vote. Our residents vote in elections, right? That's a form of independence. And even if they don't want to participate in activities, they don't have to. A freedom of choice of doing what they want to do.
Another thing people often say, just right along that line, is people don't want to be helped. They want to make a contribution. They want to feel that their existence and what they're doing serves a purpose to someone else. People want to be useful. People want to be valued. And one of the significant elements to that is, as we examine our culture, is how do we value our elders? There are lessons to be learned from that, from other nations and other countries. And boy, people just want to take all this experience that they've had and use it for some good, instead of being looked upon as frail and not being able to contribute. I think people value that as quality of life.
Lisa, did you have anything to add?
Yeah, I agree with Leilani. They want to share their experience, and there's even programs set up, again, in the county for them to do that. The Retired Senior Volunteer Program, they love the seniors, absolutely, and they can do things, I mean, as little as making phone calls to other people, you know, as a telephone companion, all the way to assisting, you know, you name it, and they're there, believe me.
Elder, you had a
Yeah, one of the things I like calling them not senior citizens, but seasoned citizens, because they're seasoned. And like you said, Leilani, they have so much to share.
Yeah.
And when you give them the opportunity to share, you know, knowledge is power. And they can help us along, without a doubt.
For these seasoned, didn't say seniors, I'm going to try the seasoned for a while and see if it tastes good, or if it works. It might be a great seasoning. So seasoned adults in America. Let's talk about that group. Now, baby boomers exercise more and watch their eating habits more than some preceding generations. Are we going to see a bounce of some kind where you think that the health might be a little better for the baby boomers than for the two generations preceding them?
You're actually seeing it right now. If you talk to the people who do home-delivered meal programs like Meals on Wheels, they will say that about 15 years ago, the people who were receiving the meals were between 65 and 75. Today, those people are between 65 and 75 are delivering the meals to the older adults and to the homebound frail. So
what are some other changes we're seeing in how baby boomers age versus two preceding generations? One of them is they're really not looking for help early on. That would be one.
And you have to remember, we are living a lot longer than what we used to live also, with the exercising, the eating, and the medicine.
Well, we know more now. We're more educated about our own health, so we know how to do work that minimizes our risk factors for chronic illnesses, just specifically Alzheimer's disease. There's so many things that we can do that we didn't know we could do 15 years ago.
Right.
I don't know if this personal experience that I've had reflects a trend in America, but maybe you can tell me. I don't hear people talking about retirement. I hear them talking about their next career. Is that part of the story of seasoning Americans? For more Medical Matters television shows, go online to medicalmatters.tv.